Welcome, everyone, and thank you for attending this evening's event on screen time, social media, and youth mental health. My name is Trisha, and I am a parent of a sixth grader at King Philip Middle School and a member of the West Hartford Community of Concern, an organization that works to raise awareness about issues that impact youth mental health and wellness. Those include anxiety and depression, discrimination and bullying, vaping and alcohol use, and other risky behaviors. We are so excited to provide you with an engaging conversation with experts on how screens and social media affects youth mental health and tips for encouraging and implementing healthy technology habits at home, in schools, and in other places. We are simply focusing on the overall well-being of our children. And with the content development, or better yet, the influx of new social mediums and screen types, we must ask ourselves, how do we keep our children safe? How can we also support them in these types of digital connections? And how can we as a community, not just in the home, but in additional settings, help our youth set values to reduce the harms? Finally, what are the benefits of screens and social media? So for the next 45 minutes, along with hearing from our panelists, we will view short videos of West Hartford Middle School and high school students sharing their thoughts and insights on screen time, social media, and its effects on them. At around 8 p.m., we are planning to answer questions from the audience. So please put them in the Q&A and we will try our very best to get to as many as we can. Now I'll turn things over to another member of Community of Concern, Gigi.
Thank you, Trish. Good evening, and thank you again for joining us this evening. I'm Gigi. I am a parent to 4 kids ranging in age from 8 to 14 years old. So I'm very excited to hear about all our experts tonight. There's a lot of information and advice to sort out about how screen time affects our kids. Robb is the Senior Director of Research at Common Sense Media, an organization that provides education and advocacy to families to promote safe technology and media for children. Mike will discuss themes from the research about the impact of screens on adolescent mental health that parents, educators, and youth need to know. Before that, we're going to hear from our students about screen time, what it means to them, and how it makes them feel.
I usually either go on my phone, like when I'm bored, to like text my friends or something, or just watch YouTube. And then I go on my Xbox to play games with my friends and talk to them and stuff.
I usually think of screen time about like time I spend on my phone or iPad or things like that, but like not related to school, I'd say. And then like when I get to school, teachers will talk about screen time and then they'll talk about it including school. And then I think of how much more time I spend on the screen.
When I come home from school, I know that I'm probably going to relax by using social media to kind of like take my mind off of school and all the schoolwork I have to do.
Feel kind of like calming sometimes if you think about it, because you're just on your screens, like you don't worry about anything else.
Okay. All right. Well, thank you all for having me here today. Thank you for the introduction. My name is Robb. I'm the proud parent of 2 boys in the West Hartford public school system at Aiken Elementary School. But I'm not here just because of nepotism. I am here because I actually have some subject matter expertise as a senior director of research at Common Sense Media. So I'm really happy to have been invited here, and thank you to Community of Concern for having me here today. So they asked me to talk a little bit about screen time and mental health and some of the kind of themes that emerge from the research. And the research is what I know best. So what do we know about screen time and kids and mental health? I think with kids and adolescents, we hear a very specific kind of repeated set of messages about device use. So if you listen to the news, or if teens are listening to their parents, or just kind of in casual conversation, you might hear concerns about technology addiction. You might get some media coverage that's focused on how smartphone use might be to blame for increasing rates of depression among youth and adolescents, particularly among girls, as well as increases in suicide or self-harm. Other common fears are that adolescents are becoming disconnected from their parents, from their friends, from the offline world, and that they're just increasingly immersed in a digital world. You also hear lots of concerns over things like cyberbullying. And so, these fears are really common among parents and among teachers. And like the common narrative is that smartphones and social media use are linked to these issues and to others, right? But what is the evidence, right? The fears are really high, but what is the evidence? So several large studies of young people and teens have found correlations between heavy technology use and unhappiness or depression. But as scientists love to say, we say correlation is not causation. And all that really means is that just because we see a relationship between two things, it doesn't necessarily mean that one thing causes the other. So it could be that heavy tech use is causing kids to be depressed and anxious. But it could also be that kids who are already depressed and anxious are seeking refuge online. And when we look at the research, the relationships that we see so far, I'd say tend to be kind of weak. So, and what I mean by that is that we find a kind of a mix of positive, negative, and a lot of kind of neutral associations or relationships between, for example, social media use and adolescents' mental health. And when we do find a relationship that exists, the strength of that relationship tends to be on the small side. Oftentimes it accounts for kind of less than 1% of the outcome that we're looking at. So it might explain less than 1% of like depression outcomes or something like that. And like I said, oftentimes it offers no way to separate cause from effect. So when I look at that, I think to myself, well, the failure to find a simple cause for increases in teen depression or teen suicide probably shouldn't be surprising, given that mental health disorders emerge from a really complex set of social factors and genetic factors and experiences, which all have lots of different kinds of influence over development and across different kinds of situations. There's not a lot of longitudinal research. That is, we don't know, we don't track kids over time generally in the research because that is really expensive and hard to do. There's some research that does suggest that early mental health symptoms might predict social media use. The social media use doesn't necessarily predict later symptoms, but like that might only be just for girls in studies. Overall, though, I would say much more research is needed, right? Longitudinal research, what we call experimental research, where we can do experiments where some people are using certain kinds of social media and other people are not. And I think one of the issues with the research that we know about, and one of the themes that keeps coming up, is that the research is inadequate because it's trying to treat social media use as if it's one thing, or screen use as if it's only one thing. And ask any of those teens in that video, like when you say like screen time, like, oh, are you talking about like me playing Fortnite? Are you talking about me like video chatting? Are you talking about, I know one girl mentioned like doing schoolwork. Are you talking about me like sharing videos or pictures on Instagram or on TikTok? There are all these different kinds of things that we're talking about, and they don't all do the same things. They allow kids to express themselves or kind of meet different needs at different times for different reasons. It's also a mistake to treat all teens as if they are the same. So to say that social media affects teens is the most general thing you can say. We will be much better off in the research if we can say that, oh, certain kinds of social media use are not good or are good for certain kinds of kids. So, for example, like we should be thinking more about populations that are especially vulnerable, right? So kids who are especially sensitive to social evaluation, right? Who may have what we consider to be kind of like low status offline already, or already have like a history of being victimized or bullied, right? Those are kids who are more likely to have vulnerabilities as they go into, social media and other kinds of online spaces, right? That's why I think you're starting to see some research that suggests that maybe specifically for young teen girls, there might be, more concerns around social media use, and maybe specifically not around all social media use, but around, using social media use to socially compare yourself with others or kind of create like perfect body images or things like that. One other thing I want to note before I kind of end my talk on these themes here is that the kind of flip side to, like worrying about how social media is affecting kids' mental health, which we absolutely should and continue to do research on, is that kids also use social media proactively to support their mental health in some ways. So in some of the research that we've done at Common Sense, we find that among teenagers and young people, about half of them are going online to look for people who have similar health concerns and mental health concerns as they do. About half of them are using technology to connect with healthcare providers. They're like doing telehealth or things like that. So we find that social media is playing an important role for a lot of young people. It helps them stay connected to friends and family. It helps them learn how to, it helps them connect to people who have similar kinds of issues. I would say for people who have symptoms of moderate to severe depression, this is like a vulnerable group, that those are people for whom they're probably experiencing high highs and low lows more. So more likely to be saying that it's like they're feeling less alone, they're getting support and advice, but also more likely to be saying it's making them feel worse in some cases, but also better in some cases. And one thing that I think we'll talk about later is I think we really should be moving away from talking about screen time, which I think is not useful, to talking a lot more about kind of screen quality. So screen quantity to screen quality. And I'll end my comments there.
Thank you, Mike. I really appreciate all the information you gave. My computer just kind of glitched, so I haven't missed like most of what you said, but I can't wait to rewatch it when I watch
it
the
was
recording.
all genius gems. And
I was like, you're probably solving all my problems when it comes to screen time, and I just missed it in the moment that my computer, all these tech problems that you have, or that we have in this age. So yeah, I can't wait. So now we're going to pivot. I know I'm not the only one who worries that her kids are addicted to screens. Screen use is an integral part of life today, and it is not going away. So how can we keep that in perspective, and when should we worry? So to answer that question, we're going to turn to Kristelle Lavallee Collins, who is the Senior Content Strategist at the Digital Wellness Lab at Boston Children's Hospital. So the Digital Wellness Lab provides resources on how media can affect health and well-being, and also treats adolescents and young adults in their clinic whose excessive online activities have caused problems with their physical and mental health. First, we will hear from students about how they manage screen time and social media use. And hopefully my computer will be okay for this part.
Well, like screen time, like itself, I think like it's just kind of really helpful sometimes to see like how much time I spend on each app, just because sometimes like if you're like scrolling through TikTok or like Instagram, you just like time kind of flies by and you don't realize how much time you spend on it. So sometimes I like go into my screen time and look, and I'm like, oh, like I'm spending a little too much time on this.
If I'm playing a game like with my friends and like my mom tells me like come eat dinner or something, I usually just tell her I'll come like after this game if it's like a short game, and then it usually says like 2 to 5 minutes for me to finish that game, and then I go eat.
I mean, it's definitely hard, and there are times where I'm like on watching Netflix when I should be studying for a test, and then kind of backfires the day after. But I put my phone on Do Not Disturb, like Cherie says, so that I don't have the urge to go on my phone, because if I don't get the notifications, I really don't usually have a reason to go on it.
I kind of try to be in tune with myself and what kind of posts make me stressed out or make me feel like negative moods, and which ones I think keep me happy and relaxed. So I have had to delete like certain social media apps because I realized that the majority of the content I was seeing was negative and it wasn't really helping me de-stress. It was actually making me more stressed out.
Well, thank you so much for having me. Again, my name is Kristelle Lavallee Collins. I'm the Senior Content Strategist over at the Digital Wellness Lab. And thank you so much to Community of Concern for having me. It's an honor to be here also with the panelists today. So first, I just want to say thank you so much for including those eloquent teen voices. I think it is exceptionally important that we hear directly from them. So thank you. I love that introduction, and also they had wonderful tips. I think all of us can use some of those. But as was said, we are based at Boston Children's Hospital. Boston Children's Hospital also has a dedicated clinical arm that's coming out of the lab. That is the Clinic for Interactive Media and Internet Disorders. So at that clinic, I know that addiction is a word that's really bandied about. Typically we say, oh, I'm addicted to my phone, I'm addicted to social media, I'm scrolling through, I'm addicted. It's very much a term that's in the public vernacular, but when we go over to the clinical side of things, we at Boston Children's Hospital are noticing something that is very different in that it is not a clinical addiction. The other problem with addiction is it's heavily stigmatized. When we think of addiction, we think usually about substance or behavioral addictions, and we really want to take it out of that addiction space. And we've developed some treatment manuals. We've also developed kind of a system of seeing what the symptoms are for what we call problematic interactive media use, or PIMU. So that's what we treat over at our clinic. And I think the best kind of analogy for treating PIMU or thinking about PIMU is also thinking about binge eating disorder. So when we think about binge eating disorder is the overuse of a necessary resource. So the necessary resource in binge eating disorder, of course, is food. We at the Digital Wellness Lab really see this issue as an environmental health issue. Right now, I completely agree with Michael Robb. The notion of screen time is absolutely 100% obsolete, especially for children. It is not, oh, the time I'm spending on screens and the time I'm not spending on screens. It's the time I'm spending living. It's really that seamless. It's absolutely their environment. So again, going back to binge eating disorder, it is the overuse of a necessary resource. When you're in the midst of a binge, kind of like what some of the teens were expressing, you lose track of time. It becomes the number one priority is just getting food into your mouth. It becomes playing the game in terms of screen time. If you think about video gaming or scrolling, it becomes all consuming. There are negative ramifications, of course, of binge eating disorder. Typically, those are physical. It also interferes with your daily life. The same is true for problematic interactive media use. So much like with a binge eating disorder patient, you can't just say, hey, turn it off, the problem's gone, or stop eating and the problem is gone. These problems are going to, if you want to call them problems, are going to persist because technology is, again, part of the environment. You absolutely need food. It's a necessary resource just as much as technology is a necessary resource. So at our clinic, our whole goal is in terms of rehabilitation. How do we live with technology in ways that are healthful, balanced, and mindful? So that's kind of on the treatment end. I will say I was asked to, I know all of the parents who are attending tonight, the biggest concern is how do I know if my child has a problem? And that is one of the number one questions that we get asked at the lab. So I'm going to kind of list off a kind of clinical symptoms checklist for everyone here tonight. But really the things to look for are a behavior switch with your child. Now with teens, it's a little hard because we know the stage of development that they're in, there tends to be a lot of ups and downs, a lot of moodiness. So this is over you're the parent, you know your child the best. But spending more time alone in their room, poor sleep or excessive daytime sleepiness, typically that symptom is noticed by an educator. You know, the child is falling asleep during class, they alert the parents. Poor personal hygiene, decreased levels of self-care, social withdrawal, secrecy, and extreme measures to access media. At Boston Children's Hospital, we often see some of the most severe patients. So when I say extreme measures to access media, we're talking about the child who will take a sledgehammer to the family car because they believe that the video game console is locked in there. So really extreme, not just kind of a temper tantrum. And then increased irritability, especially when offline. And again, those are kind of the symptoms checklist that we look for. That said, it is our aim to never see a patient in our clinic. We would love to just have all preventative measures be in place. So there are a number of ways, that we can kind of foster balance. And I'm sure we'll get into many of those, but I did want to kind of go through the difference between what we see as addiction and problematic media use. And I'll kind of end there.
Thank you, Kristelle. I really appreciate that concrete list of like things to look for. I mean, I think as parents, we worry and think a lot about our kids and want to make sure they're okay. So it's like really helpful to have almost like a checklist of like, okay, I think that we're either okay or we need to work on something together. So that was super helpful. Thank you. So let's start thinking about social media. Engaging with social media can bring out the best and the worst in adolescents during a rapid time of their growth that impacts how they feel, think, make decisions, and interact with the world around them. Dr. Caitlin Elsaessar is an associate professor at the University of Connecticut School of Social Work and a licensed clinical social worker. She is currently working with Hartford violence prevention agencies and youth co-researchers on a project to design support for youth to navigate social media conflict. Caitlin will talk about harms that can come from social media use and how parents, schools, and students can work together to protect kids from those harms. We will first hear from students their thoughts on social media.
I use TikTok mostly because I just use it for fun. Just to show people what I'm doing or just to express how I feel sometimes.
Snapchat, because that's like what I usually like text my friends on.
Being on certain apps helps me to connect to, I guess, the outside world. So talking to friends in other places through messages and sending them like social media posts, I think that's like a really big part of my life right now.
Like young people using social media platforms like as their platforms and their voices, because we might not be able to vote, but we can like share our ideas.
I would see the news every single day, or like stuff on like TikTok or just news in general, and it kind of like it makes you like upset, and it's kind of like ruins your whole mood for the whole day.
It's kind of addicting to just stay on your phone and to just like use those sorts of apps because you're like wired to it.
I'd say just in general, maybe the time I spend on social media and different screens, because it can lead to stress in the end if I'm spending time on Instagram or something instead of studying.
I definitely think that the algorithm does its job. I think that once you like one post pertaining to like a specific topic, you kind of get sucked down a rabbit hole.
Hi, everyone. It's great to be here. Thank you so much for this invitation, and I've really enjoyed hearing from everyone so far. And what great teen voices in the mix. So much wisdom and perception there about they're like the experts and how social media impacts them. Yeah, so I work at the School of Social Work just a few minutes away in Hartford. And I am also a clinical social worker and have spent much of my career working with adolescents. And so I'm going to be speaking specifically, I was asked to speak specifically to social media use. And, there is an accumulating body of evidence around how social media impacts youth development. and is complex. It really is not all negative. I agree with Michael in terms of really bringing some nuance to how we understand how social media impacts development. For example, we know that social media can be a really important place for young people to connect with special affinity groups, support groups over certain particular mental health issues, or if you're part of a particular marginalized group, it can be a really important space to connect with others. And we also know that things like active versus passive use also differ in whether and how they impact mental health, youth mental health. So we know that, for example, being actively engaged in social media and seeking out friends or connecting with friends, or versus kind of passively scrolling through and watching other posts come in, the passive use tends to be connected with worse mental health trends. But I guess I wanted to step back a little bit and just talk about, one of the things I think about as a social worker is youth mental health trends. And one thing that we've seen over the last kind of 15, 20 years is a really concerning decline in many indicators of youth mental health. So we see higher levels of depression, higher levels of anxiety. And a lot of these things, while correlational, have kind of connected with the timing of the advent of the smartphone. And there is a lot of evidence out there that higher use of social media is connected with some really concerning outcomes for youth, and adults as well, but especially thinking about adolescents in that vulnerable time period. So things like higher likelihood of comparing ourselves to each other, fear of missing out, body image issues, particularly for young girls. My own work has focused on understanding how social media as a particular environment impacts conflict. And what I heard in focus groups with young people is that in the context of social media can heat up a conflict and it can get really escalated very quickly. And these are because of very specific tools on social media, things like the likes and the capacity to see how many likes has a post received. I've heard from teenagers that even simply posting a haha comment might be misinterpreted, and then someone perceived that as insulting, and then other people chimed in the likes and the comments, and it turned into a fight. And so particularly, I think this piece around an audience can really be play into some of the vulnerabilities during adolescence, because there is such a concern and care for what peer connections and friendships. And so I think, one thing that I think about a lot, and this has come through in my own research and my read of the literature, is really understanding that social media is a particular environment. And it's an environment that's been designed by engineers that have spent thousands of hours designing these platforms to capture our attention. The product for social media is attention, as I think many of us know. And the more attention that we spend on them, the more money that these companies make. And so, that was highlighted in the recent testimony about Facebook last month, that Facebook itself in its own internal research is aware of the negative impact on health. And yet there's this tension with the profit that is made off of our attention. I think Cherise spoke to that really well in the video leading up to my introduction. And so I guess I don't want to paint, social media certainly has some positive uses, but I think it's just really important to approach it with a lot of skepticism. And so in terms of, I was asked to speak to a little bit about what parents and young people can do. And I don't think there's no easy blanket answer. I do think that, the best solution would be to have companies design social media platforms for humane use as opposed to use around profit. And so again, like, I think that's a really important backdrop because even as adults, we're aware of the ways that these devices platforms feel often addictive. They're bringing in our attention. But a few other things to highlight, and I think these are things that we can bring into our conversations with young people, whether it's teachers or around the dinner table. One is to just simply ask about experiences on social media, to make it part of family conversations. A lot of the young people that I spoke to in my focus groups, it seemed like it was the first time they were speaking about these experiences in the focus group. I think a lot of times we as adults don't remember that experiences on social media. I completely agree with Kristelle. There's not like social media versus the real world. It's collapsed. It's like porous. And so, relationships can be broken, reputations can be broken or made on social media. So just making space to talk about it, to take it seriously, what young people experience online. And I really heard some beautiful mindfulness coming up from the youth who were interviewed. And I think that's another really important tool to encourage in the young people that we work with and in ourselves. We can model this of, how do I feel after spending an hour on social media? What kinds of uses on social media feel good? And which ones leave me drained, where I kind of am coming out of a haze. So I think our own bodies tell us the best evidence for whether the use is positive or negative. And then the last thing I'll say is, one thing that we know, at least that has come out in the literature so far, is that social media, it doesn't work to just set hard and fast rules as parents, as much as maybe there's a lot of fear out there, as Michael said, but the technology is changing so quickly that we as parents, we can't keep up with it. Young people are always going to be able to navigate around rules. And so I think really coming up with practices together is an excellent approach, really figuring out what makes sense, exploring the platforms together, seeing what feels risky, but not, as opposed to kind of coming down hard and setting really tough rules, because it probably is going to be difficult to enforce. Okay, thank you.
Thank you, Caitlin. I feel like you basically made a nice introduction to Andrea, our next panelist as well, with what you were saying at the end. And I think there's just so much to get from what you were saying in terms of like social media. Just there's like no wall between social media and like the world that our kids are living in right now, that I think is like so foreign to many parents still as they're trying to figure out how it works. So I appreciate all your insight. So our next and final panelist is Andrea Davis. Andrea Davis is a former secondary education teacher turned screen time navigator and the founder of Better Screen Time, where she shares family tested ideas from the tech trenches as a mom of 5. So the pandemic heightened reliance and use of screens and social media, making us rethink family and school tech use guidelines and rules. So, for example, the allowable age for kids to access social media is 13 years old, but younger kids have also benefited from using it to stay connected with friends. And as our panelists have highlighted, like that is a major benefit in terms of the social interactions that kids can have online. So Andrea is going to talk about how parents can determine at what ages kids should use digital media, how they can foster appropriate online habits, and monitor their mental health. So first, we will hear from our students when they first got a phone and what rules there were around usage.
I got my phone around, I think like 6th grade, but more like going into 7th grade, a little bit. And it was like real restricted. Like I couldn't have social media. It was kind of just like for YouTube and like for safety and just to like message my friends.
I also got my phone in 6th grade, and when I got it, I wasn't really allowed to give my phone number out to people unless I really trusted them. And I also wasn't allowed to have any social media apps or keep my phone in my room on school nights.
When I got my phone, my mom didn't really like talk to me about like apps that I could or like could not use. I kind of like just found that out on my own. But like she does have like a screen time limit thing where like my phone turns off at a certain time when like she wants it to, and then turns back on when she wants it to.
I started using TikTok. My mom, I had to first find out about it first before I started using it. Like I had to find out about like the safety and about what could happen and
Okay, I love those videos with all these teenagers. This has been such an awesome part of the night. And thank you to the community of concern for inviting me here. Again, my name is Andrea Davis. I'm the founder of Better Screen Time, but I am also a mom of 5, and my kids range in ages from 7 to almost 17. So I actually bridged that technological gap of having had kids pre-iPhone, which is hard to believe, to having kids after. And so I have watched firsthand the difference and just the rapid changes that technology has made, and especially how it's affected our kids and it's affected parenting. And I think one of the biggest questions that parents want to ask is what age? What age do we allow a cell phone? And these teenagers all talked about, what their parents' rules were, and they were all different. And at what age do we allow social media? And so there are 2 things that we really need to keep in mind when we consider these options and ages. And the first one really comes from my background of being a teacher and knowing what we know about child development. And that is that we know that our kids' brains are not fully developed. And so the prefrontal cortex, that part of the brain that's responsible for decision-making, is not fully developed until we're in our mid-20s. And so what that means is that our kids and our teenagers are not capable of always really thinking things through and making a decision and seeing, okay, if I do this, this will be the consequence, or this will be the result. In fact, even as adults, sometimes we still struggle with this. So that's really important to keep in mind, that our kids' brains are not fully developed. The second thing to keep in mind is exactly what Caitlin brought up. That is the fact that we have very smart people on the other side of these screens using persuasive design and designing these apps to keep us connected and keep us hooked. And they are making games, social media, everything as engaging as possible, because a lot of these things are free, but we may not be paying money, but we're paying with our time and with our attention. And even as adults, we know that. And so knowing those 2 things, the apps that our kids' brains are not fully developed and the apps use persuasive design, we as parents have to be smart about how we allow, as we walk through these different phases and we allow social media, or we allow cell phones, or we don't, how do we decide? And so, yes, we kind of might have the ground rules where these big tech companies have said, okay, 13 is age. But as a parent, I can tell you that, it is wise to make these decisions together as a family, and not to take big tech's word for, okay, your child's 13, that means they're ready for social media. No, you are the parent, and you get to make these decisions together as a family. And I think that's one of the most important things that I want to express. As we were trying to figure out how to do the whole cell phone thing, we sat our whole family down. We actually just had like a family meeting, and we asked our kids 2 questions. And we said, number 1, what does it mean to be responsible? And our kids made this big list. And if you do this at home, your kids can do this too, but they know, right? Like, you get up for school by yourself without anybody waking you up. You do your chores without being asked. You do your homework. You're responsible with your belongings, all these things. And then the second question we asked is, what does it mean to be emotionally mature? And now with younger kids, that might seem like kind of a difficult question, but as we kind of unpacked that, the kids said, okay, if I'm emotionally mature, that means I'm kind to my siblings. Or if it's time for me to get off of a device or off a computer, I don't throw a fit or throw a tantrum. I can handle things when things don't go my way. That's being emotionally mature. And so we made this big list together. And my husband and I said, yes, And those are the things that a person needs to be able to do before they are responsible enough to have a cell phone. And I just encourage every family to do that, to have that conversation, because again, we need to take a collaborative approach. If as parents, we just say, okay, here's your phone, here's a cell phone contract, here's all the things that you should not do, sign it, and let's see how it goes, then that's not the approach we want to take. We want to mentor our kids and not just monitor them. And so we made this list, and that's just kind of how we've done this with our kids. But the other thing I want to bring up that each of these teens brought up in their video was that some of their parents took a graduated approach. And that's something that we teach at Better Screen Time, is not just like, okay, here's a smartphone with everything on it, fully loaded. Instead, let's take this slowly and let's work together. So we're starting with just the very basics of texting and calling, and then we're going to work up to maybe adding some apps that are useful, that maybe they're using at school. And this is, I'm talking about a high schooler. And then at the very end, way down the road, again, where we have a self-evaluation that we use at Better Screen Time called, Am I Ready for Social Media? And it has the child's side or the teenager side of things that they should be able to do. But there is also a parent side. So this isn't just about our kids, but it's about how have I as a parent prepared my child? Have I talked to them about pornography, about cyberbullying, about sexting, about online predators? Have I done my part? And that, again, it's a collaborative approach. And we do a parent-teen pledge where we're trying to help our teens. We're talking to them about their values and how can they live their values offline and online. And I think that self-awareness is so key, because that's what's going to carry them when our rules, they step out the door and our rules are gone, or they find a loophole and they find a way to get around screen time or whatever we're using. Then it's those values that they've decided on that they want to live, no matter where they are, what device they're on, what filters in place or not in place. And I just can't emphasize that enough, that it's helping our kids develop that strong sense of self before social media can tell them who they are. So those are my thoughts.
Thank you, Andrea. I really appreciate everything that you just sort of said. And I already thought to myself, I was like, I have to good thing I have 8-year-olds. We're still growing older, and I can sort of rethink how we sort of approach social media and phones and stuff like that. But I really appreciate you talking about mentoring and not monitoring, and also a self-evaluation for parents. I think that was really something new for me, because I think, I would talk to my kids about what they needed to do, but it's also a nice thing for parents to reflect on how they're supporting their own kids as they figure this out. So I want to thank all our panelists for sharing their expertise and all their time and taking the time to be with us this evening. And thanks also to our students for sharing their experiences in using screens and social media. We had received a number of questions in advance from people who registered for our webinar, and our students had a few questions as well. So for those of you with us live, please continue to use the Q&A to submit your own questions, and we will try to get to as many of them too. Our first question is for Michael, from one of our students, Marley, who asked about the average length of time kids use their phones. So a lot of people submitted questions generally about the time that kids spend on screens, and they seemed worried about the adverse effects. So what does the research say about the effect of screen time on brain development? You're on mute, sorry.
Okay, here we go. So a couple of things. So the first question that I heard was about how much time kids are spending on devices. So the most recent research that Common Sense Media did, which was in 2019, we found that kids between the ages of 8 to 12 years old spend on average kind of just under 5 hours of time with entertainment screen media. So that's screen media that's not related to school and not related to homework. And then teenagers between the ages of 13 to 17 spend an average of about 7.5 hours a day with screen media. And again, that's not including using screens for school or for homework. So one thing to think about in terms of those numbers is that it's certainly possible that that's 7.5 hours out of the day or almost 5 hours out of the day. But because kids multitask, and all of us multitask frequently, it's also possible that kids are cramming a lot of screen time into a shorter period of time. So, if I'm watching TV at the same time I'm flipping through my phone, I might be able to cram 2 hours of screen time into one actual hour out of my day. So anyway, you want to split it, it is quite a bit of screen time, and it has gone up, quite a bit over the last 10, 20 years. The other question that was asked was, what does the research say about the effects of screen time on brain development? And the very unsatisfactory answer is that we don't really know, because like I said, most of the research that's been done is cross-sectional, which means they are taking, they're just basically trying to find relationships between things, but they're not able to tell whether something is causing something else. So you can see that in some research, for example, that kids who are spending an excessive amount of time, and how you define excessive depends on what study you're looking at, but say, for example, saying, 7 or 8, 9, 10 hours of time on screens may be also showing more symptoms of ADHD. Not that they have an ADHD diagnosis, but maybe showing kind of more symptoms. Does that mean that the screen time caused ADHD, or does it mean that kids who already have symptoms of ADHD may be seeking out screens more, or that their parents are more likely to give them phones or be in environments where there are more screens? We don't really know from a lot of the research. Another issue, I think, with the kind of what effect does it have on brains research is, I think it's hard to say, because I think when you hear the term like brain science, it kind of brings up all this imagery that like this really hard science that we know that if you watch a screen for X amount of time and you're using Instagram, that your brain is lighting up in all of these different places. And I think a lot of that research at this point, for right now, may not tell us satisfactory answers. Because again, you're really only getting kind of a slice of like one kid at one point in time. And so we really have to fall back on, if we can't look at like fMRI research, what can we say based on other kind of social science research that talks more explicitly about, or tries to link people's screen time and screen usage to different kinds of outcomes. And I was trying to allude to in the first part of what I said is that when we look more closely at specific kinds of usage, that you begin to see clearer relationships, right? So that kids who already have or are cyberbullied, or have, low kind of low status, right? That those kids are more likely to suffer harms online than other kids. Teen girls who are using social media and are using it, I heard the term like kind of passively, mindlessly, kind of just kind of going through, and they're not engaging, they're not connecting with friends, but they are spending a lot of time wondering, like, why doesn't my body look like this, or why isn't my life like this? That is a more likely to lead to a research finding that shows that kind of usage is negative. But when we just look at screen time generally, it's not a great way to tell what's going on, because really, like we'll keep trying to emphasize this, like different kids are using different kinds of media for different reasons at different times. And the more you know about each of those things, the better you'll be able to pinpoint what kind of a relationship there is. So, I'm cautious about just saying anything general about screen time, but if you do see things that are concerning and how your child is responding to things that they're doing, then certainly that is a good opportunity to have a conversation. I loved what Caitlin was saying about like your body is telling you already what you should be feeling, right? Like, the kids can already tell, like, oh God, I feel terrible after having to do this. I have the same thing myself, not with social media, but with the news. When I read too much news online, it makes my body feel bad. And so I know I have to like pull back. So your body does give some cues about like the kinds of media usage that are not making you feel good. Whereas frequently, if kids are, lots of kids say that social media makes them feel less lonely or makes them feel good. And usually in those cases, it's because they're connecting with friends. They're doing the things that they would have done without social media, right? Like the things, they're seeking out their friends, they're trying to find a time to hang out, or they're entertaining themselves. The number one thing that kids do with media is not social media, it's watching TV and watching videos, right? That was sort of like, all the things that happened before a smartphone kind of transferred over into like a new venue online. There's just more of it and it's more accessible and there's more choice than there used to be. So we really got to know a little bit more about what people are actually doing.
Right. In terms of like figuring out what exactly they're doing on the screens really does matter.
It does.
Yeah. Well, thank you. Kristelle, earlier you mentioned some preventative measures to foster balance, and then you sort of just left it. So I have to go back and ask you, could you please share with us some preventative measures to foster balance?
Yes, absolutely. And I do want to say I left it. It's a really broad topic, which is great news. But I love that Michael kind of touched on the nuances that, it really is child specific. So I think that's important to kind of touch on. One of my favorites is actually something that's really simplistic. And I think something that Andrea spoke about when she was referring back to her own practices with her own family. And that is we really encourage parents to sit down with their children at the onset and make them a part of the conversation. Now, obviously, this can be done with kids who are, they're vocal. So 5-year-olds can be a part of this conversation. But something that's really helpful and that we saw a lot of like throwback to, especially during the pandemic, is just simply sitting down and taking your 24-hour day. And we recommend, you can do this in an iPhone or any kind of phone or a planner, but we actually recommend I can even show mine, taking the 24-hour day, having it all just in a book. And the first thing that you need to put on there is sleep. So that'll block off a number of different hours. Then you block off school time. Then you block off homework time. Then you block off time where the whole family sits down for a family meal where devices are off, including background television or any kind of background screen media. And then you ask them what they want to do. What do you want to game for a little while? Do you want to have time on social media? Where does that fit into your day? So then they block off that time, but that is obviously going to come at a cost of other activities. That might come at a cost of seeing a friend actually in person, or maybe they can actually combine those activities and game together or use social media together. But it gives the child or teen or adult, a concrete way of seeing how they're spending their time and can use it more mindfully. So again, you're bringing mindfulness into the practice of using media, which is a prevention in terms of going into that problematic use. They now know how their time is being allocated. So that's probably one of my favorite kind of simplistic ways. But I will say the evergreen way is really just making sure that the conversation, that there's always an open dialogue. And that parents are continually involved. We often hear, from the patient's families, because again, we approach treatment from a holistic kind of family systems approach. We often hear, oh, I wasn't involved because, their phone is private. And that's something we really discourage. The phone is not private. The phone is a privilege to have. So parents should have all the passcodes. It's not, I heard a great term today. It's not helicoptering, it's huddling. So having those continual kind of family huddles where they check in, what's going on, in the social media space, what's going on, gaming, what's going on. Because as we said, it's not about screen time, it's about lifetime. So really being a part and being present in all aspects of the child's life, is crucial. And when you do that, that's prevention right there. We never see patients in our clinic who have parents who are doing that kind of continual check-in and that ongoing dialogue.
Thank you. That was super concrete. And I was already thinking about how I would even do that for myself. But as you mentioned, like the parents having a role in it, Andrea also talked about having these open dialogues with your family around it. So I wanted to turn to Andrea and ask, what do parents do when they don't agree on screen time rules for their kids?
Yeah, so you can hear me, right? Okay. Yeah, so the first step really is to have that conversation when the kids aren't right there. So having a private conversation just, between the two of you, and really talking through it. And one thing that's been really helpful for us and that we help other parents with is just to realize that quite often it's kind of good that you don't always agree, because quite often it will bring balance to your kids' lives. Because usually there's one parent who is much more like, wants to apply all the filters and doesn't want the kids to have any screens. Another parent might be a little bit more relaxed. And so by coming together and compromising and collaborating, quite often then we're bringing our kids a balanced approach to technology, which a lot of the panelists have mentioned is really a healthy approach because it is part of our lives and it's something that we're using. So I think having that mindset that it can be helpful if you don't always agree. And then coming together and also sharing the research. So if you are the parent who perhaps spends more time studying this, it's probably whatever parent is watching this panel and is here attending tonight, you might be the one that's more concerned about it, or you're more aware of the research. Don't be afraid to share what you've learned and share that research, and then share why. And I think that's always so important. So it's not, we always want to parent from a place of confidence and not from a place of fear, right? And when it comes to screen time, quite often we can't, like Mike mentioned, we can start to feel that fear bubble up. And so if we're having the conversation with a spouse or partner and we are sharing it out of fear and we're panicked, then we're not going to come to a great solution. But if we're coming at it and we're feeling confident that we need to make some changes as a family, and this is why we need to do it, because I've seen this happen with other kids. Or if you trust your intuition as a parent too, because your kids best. And so as has been mentioned before, there are some kids that are more prone to depression, that might be more prone to being cyberbullied, and your child. And so if you feel like, hey, I really don't feel like allowing this child to play video games is a great idea, then, let your spouse or partner know why. And I think it is just a matter of lots of communication, lots of listening, just like all the things that we've learned over the years about collaborating and working with other people, but listening, being willing to listen and being willing to bend a little bit. But also if you feel strongly about something, keep bringing it up and stick to your guns.
Thank you, Andrea. So I want to turn our focus to social media specifically. So another question from one of our students in the videos, Afaf, was, do the benefits outweigh the risks for social media? So I'm going to ask Caitlin to answer this question. Caitlin, are there more consequences or positive sides or positive sides to social media? And moving forward, how will that affect kids in the future?
All right. Well, I think this is almost an impossible question to answer. It's a great question, and I think it's something that frames what so many of us are feeling when we're on social media. But, I guess I'll just say a few things. One is just to really, I think it's so important to bring skepticism to our use of social media, knowing that the platform has not been designed by people who are trying to maximize mental health or even necessarily enjoyment or social connection, but the model is to maximize attention and to maximize our keep going. So intermittent reward, and having one thing that's different about watching videos on our phone versus the old school TV is, the next video is going to be suggested. One of the teens even mentioned that, oh, I clicked on this thing, and then all of a sudden, my feed is totally changed, and they're reading, I shouldn't say they, but the artificial intelligence is really tracking our behaviors on social media and trying to kind of pull us in. And so just to bring some real skepticism to our use of social media. And I think, really it's so powerful to just see for ourselves, what kind of activities feel good, what kinds of activities leave me feeling drained. One of the things I just think at least one of the things that I've heard in our focus groups with young people is that there is really no replacement for offline personal connections and close trusting relationships. So certainly friendships on social media can maybe enhance, and of course there's like, it's very fluid between online and offline. But when we heard people who were in trouble from teenagers, when we heard that a young person had gotten in trouble with some kind of situation on social media, it was actually almost always a connection that they had offline that helped them navigate that. So it was a close connection with a parent where they felt like they wouldn't be judged or could come to them and just kind of talk through a challenging situation, or friends that they knew would have their back. But I just think that, or like a counselor, but there is really not a replacement for those activities, and you know, but I think what I think we can encourage our the teenagers that we work with and parent is just to really continue to check that out for themselves. Like, how do you feel after hanging out in person with a friend, and you know, how does that affect you versus like after you've kind of been texting or on Facebook scrolling through. And so really to like make space for that. And I love that phrase that Andrea used, mentoring, not monitoring. I also wrote that down because I think we're really mentoring. It's a challenging context for all of us to be navigating with this explosion of technology. It's really shifted how we spend time as just a human species. And so I think helping to mentor young people that are in our lives, and also for ourselves, of like, well, what is a healthy diet? What do we give up when we diet, meaning with our time? As Kristelle was talking about, you know, thinking about, well, what are we missing out on when we're using social media? And so helping them think through, you know, the pieces that we want to have in our lives that make us feel good and healthy: social time, playtime, time in nature. And so thinking about that holistic diet, not just, you know, is social media bad or good, but like, how are we spending our time? And what are the core components, the core building blocks of what we know tend to make people happy? Because to kind of widen the scope a little bit beyond social media, there's a lot of science around happiness, a lot of research around happiness. And we know that there's certain things like physical activity, being in nature, having close friendships, eating well, sleeping enough. Those are like the core pieces, many of the core components of happiness, or at least increase our well-being. And so I think it's important to kind of keep all of those pieces in mind, not just like the, you know, how much social media time is enough, or what types of activities, but what's the holistic picture of that we're modeling for our kiddos, and that we're mentoring our young people to grow into.
Thank you, Caitlin. Just listening to you, it just makes me think that this is so much more complicated than just even thinking about like how much time your kid is going to spend on this app or that app. Like, you really need to have all the conversations around it. And I appreciate hearing about like the importance of connections even offline for some of the adolescents that you're working with, which made me think about, you know, that being a huge positive to social media. So I wanted to ask Kristelle, because I think she has done some of this research about how students, or how can students support each other and galvanize their peers for healthy and appropriate use of screens and social media?
Yeah, this is a wonderful question. And I will say, you know, the lab is looking into the kind of the youth aspect of this, but I think, as Michael was saying earlier on today, more research is definitely needed in this area. So a quick shout out to having more nuanced research. But media literacy is huge. And I know the community of concern is related to a school system. So this is a great platform for it, but integrating media literacy education into a child's daily curriculum does a world of good. We partner with an organization called Media Power Youth up in Manchester, New Hampshire, and we have some amazing data back from that program that has been especially beneficial in all ways. That's including just kids being aware of media advertising, to being wary of cyberbullying and cyberbullying in its unintentional form too, just because we know that a child getting a certain emoji might take it one way and not necessarily the way that the sender actually intended it, because you have a lack of nuance within that platform. So media literacy is huge. Also, kind of to borrow a phrase that has been bandied about here, mentoring, media mentors. So youth who are able to kind of mentor other youth in this space. It's one thing having a message coming from an adult. It's another thing having it come from the peer. And by another, I mean, it's more powerful when it comes to you from your peer. So being able to kind of train kids in media literacy, being able to have like uplift them as media mentors, whether that's somebody in their grade that they're mentoring or even just a few years below them, that does a world of good as well in that space. So I think utilizing, especially some of the wonderful teens that you all showcased today, they gave what amazing tips. So highlighting them and lifting them up as mentors, I think is a great way to kind of galvanize their peers into using media mindfully and in ways that optimize their health and development.
Thank you so much. I wanted to ask one more question of Michael before I hand it over to some of the questions that have been coming in during our webinar. Michael, what about apps? Like how do you evaluate and recommend the different apps, and what distinguishes between like good apps and bad apps?
Sure. Well, and apps is like a really big, broad category of stuff. Before I touch on that, I just wanted to put like an exclamation point on what Caitlin was alluding to earlier, which was thinking about holistically about your child and the whole child, and just about who they are, but also about like their day and what's going on during the course of a week. And like, we have, like everyone said, and repeatedly, that there's limited research and we need much better research. And that's always a very common thing to say, but we do know a lot about child development and getting good sleep, getting good food and meals, having social relationships online and offline with friends, getting time outside, doing homework. All these things we know are important for kids. And common sense also recommends, like, if you can check a lot of these boxes, that your kids doing the things that you know are good for kids, that you maybe don't have to worry quite as much about like every minute of screen time, because you're not gonna be able to control it anyway. You wanna keep that open communication going, you wanna keep mentoring. And so I just want to put like an exclamation point on that, because I think that's a non-fear-based and kind of easier way to think about like where does screen time fit and screen use fit into my kind of overall lifestyle. And you don't have to think about it day to day. Was it 2 hours today or 3 hours today? But over the course of the week, do we mostly do the things we want to do and our kids mostly happy? Then good, maybe we don't have to worry quite so much. So I really like that. Sorry. Okay, when it comes to like recommending apps, so Common Sense has a research-backed rubric that we use to evaluate different kinds of apps based on kids' developmental level, like what's going on for kids at different ages and stages, and what might be right for kids based on the amount of violence they're likely to see or encounter in something, sexual content, the amount of kind of consumerist or materialist content they might be exposed to, bad language, risky behaviors like smoking or drinking. But then also we rate on things like positive messaging or positive role modeling, or presence of positive, diverse representations. There are lots of different ways depending on, like, are you talking about social media apps? Are you talking about TV apps? Are you talking about games? If you're interested in any of these things, you can go to Common Sense and search for different apps that you might be concerned with. When it comes to, I think, kind of more specific to our conversation today about social media, I think you have to ask, and we do ask the question about, like, well, what is it that they are kind of likely to be exposed to, or what's kind of like the universe of things they might be exposed to. So much of social media is user generated, so you don't really have a good sense of, like, how much sexual content is there going to be, because on TikTok you can go from the most innocuous to not very innocuous at all pretty quickly. So good apps have very good and easy to change settings. And if they're really well designed, then when you first enter into an app environment, it puts you into, it'll prompt you basically to control your privacy settings, to control what you post, and not unfairly take advantage of the information that you're sharing online. I think, as has been alluded to before, there are, their whole job, the people who make these apps, is to suck you in for as long as they can so that you will be exposed to as much commercial content as you can. So you have to be smart about what kinds of settings are and are not changeable, and how much they are trying to take advantage of you, right? Like, so things like, those infinite scrolls that just kind of go on forever that aren't built in, like, that's not a great feature, because kids and adults both don't have really good ways to stop themselves from just kind of seeing like what that next thing is, because they're just kind of like a slot machine. Like, maybe next time I am going to hit on a good video. So there are ways to kind of suss out what's good or bad depending on like how these things are built. But to be honest, most social media are not designed with kids in mind or teens in mind, and we would all be much better off if there was more pressure on them to think about teens' well-being when or kids' well-being when they're designing these things, as opposed to how much time can I possibly extract out of somebody. But if you have a specific question about a specific app, I would recommend trying commonsense.org, where you'll be able to find recommendations and ratings for lots of different apps.
Thank you, Michael. In the interest of time, I'm going to pass this over to Abaya. She's been monitoring the questions coming into the QA, and she's going to share a few more questions with you.
Thank you so much. My name is Abaya. I'm with the Community of Concern as well. I have 4 children, ages 3 to 13, so this has been immensely helpful and informative. We've had a lot of questions come into the chat, and unfortunately, we only have time for a few. One question that we thought was important to discuss came in, and I think hopefully Caitlin could probably speak to this a bit. She says, we understand the example of girls and
I think I saw the question that she was about to ask, which was, I understand the example of girls and body image and overall identity. I do wonder, however, how much boys and their connections to masculinity, e.g. hypermasculinity, are also exposed to harmful images. And Caitlin and I both throw it over to you.
Okay. It's a great question. To be frank, I have not thought about this question a lot. I think one of the reasons that girls that we do see a lot of connections between social media use and passive social media use and body image issues, which is one of the things that came up in the testimony in Congress with the whistleblower last month from Facebook's internal research about the negative impact of Facebook use on young girls. Is I do think girls, we just tend to see a lot, at least in my own research, more girls are on social media and using social media more intensively, and that kind of that social awareness of kind of which groups are in and which groups are out, the body image piece, the need to be perfect. But I think it's bigger than the body image piece. I think it is also just this incredible attunement to social dynamics, and the painfulness of when it's clear that a young woman is excluded from a social group, or people are hanging out without her. So I think that, from my understanding, my own research and my read of the literature, that's a lot of why we see this particularly harmful connection between social media use and girls' body image and body dysmorphia. But I actually haven't thought about the piece around masculinity and maleness. So if others want to chime in, I'd be interested to hear what others have to say.
mean, I think you're right. I think we need a lot more research here. I will, however, say that we do see boys coming into our clinic with some of these issues. So it's certainly, it's a gendered issue to a certain extent. I think there's obviously a difference between the marketing that happens towards females versus the marketing that happens towards males. But just rereading the question here, males are certainly not immune to these kind of gendered ideals, and they are getting exposed to them more and more. I think that they also get exposed to them in different ways. Sometimes the hypermasculinity exists in video game formats as opposed to social media formats. And it's just a matter of the kind of vehicle of exposure, but it's definitely something that we see with both of the genders, especially at our clinic.
Okay, we have sort of another juicy question that hopefully someone can answer. Can you talk about the sexualization of children and teens in social media platforms and easy access to pornography in relation to the development of identity, self-concept, and healthy sexuality?
I'll just chime in with a couple thoughts, and I'm really interested to hear what other people have to say. But The Atlantic came out with a big piece about the sex recession. Maybe others have read it a couple years ago, and I can try to share that resource. And one of the things that is really a little puzzling is that young people are actually having less sex than ever compared to 50 years ago. And on some ways, this is a good thing. We don't want to have unplanned pregnancies. But there is also kind of one of the things that was suggested, and kind of this is looking at the role of social media and online dating apps and pornography online. It's really changed how sex happens, and also just really understanding that there is, I think, behind the safety of a phone and the safety of a dating app, there's a certain type of risk that is not being taken in terms of knowing how to navigate awkward social situations, or knowing how to connect with someone, knowing how to navigate consent and boundaries. And so that's just, I think it's a good thing to be aware of as parents of how do we nurture healthy sexual expression and healthy sexual exploration in a time when I think that there's a trend towards less of that. And, again, of course, we want to keep young people protected from, bad sexual experiences, but there is, we want to also support healthy sexual exploration. It's a big part about healthy adolescent development. Yeah.
Okay, I appreciated what Caitlin had to say. I think one thing that's really important for us to understand as parents is the fact that what pornography is today is not what it was 20 years ago when we were growing up. So again, even on the internet, porn maybe what used to be a picture, right? But what porn is today is video. And quite often it's much more graphic than maybe we might even imagine. And it's also important to note that the pornography industry is a multi-million-dollar industry. They're making a lot of money, and they are also quite often fueling sex trafficking. And I think those are important things to keep in mind. It's important to talk to our kids about. I think it's also important, as Caitlin said, to talk to our kids about healthy sexuality, because our kids are going to be exposed to just the whole concept of sex earlier than they ever used to be. We have to start those conversations in our home sooner than we used to. And then, whatever your family's values are, you need to talk to your kids about that. And, Caitlin also touched on the fact that this generation is having sex less. And that's something that Jean Twenge talked about in her book, iGen. confirmed that fact as well, that of course, now teens are home on their phones, they're not getting out and they're interacting. So that's definitely affecting that. So again, I think it's super important for us as parents to have those conversations about what healthy sexuality is, why the pornography industry is problematic, and really how it is perpetuating really just a kind of a disillusion or an illusion of what healthy sex is, because it's not healthy the way that they're portraying and demonstrating what sex is. And so unfortunately, kids are learning that, and they actually are starting to see more child upon child sex abuse in today than they ever have before. And a lot of that is because sadly young children are being exposed. So it's pervasive, it's there, and it's just, we have to have a lot of conversations with our kids about it.
Thank you, Andrea. I think, what I find coming through from all of the panels is just the importance of the open dialogue with our kids around everything. So I really appreciate all your time and answering the questions. And I apologize to those who submitted questions that we couldn't get to. There was just so much to talk about. So I want to pass this on to Trish, who will be sharing another video of the kids.
So before we conclude, I just want to give each of our panelists space to give their last words to our attendees. And we could start with, I'm just looking at my screen, we could start with Michael Robb. Any last thoughts before we end?
I think this is a wonderful conversation to be having. I love that people seem so willing to and open to kind of like hearing their teens' perspectives, and you found that in the videos themselves that we've like invited that in. I think one thing that will serve parents well as they pick their way through this is try to go easy on yourself. There are no hard and fast answers to any of this, and everyone's just kind of muddling through the best we can with the limited research that we have. That the relationship that you have with your child is likely to be a good buffer for some of the ill effects that you might have, in the sense that if you can keep an open channel of conversation, that you may be able to hear about some things that might be concerning, but also hear about the good things that you want to hear. And that to the extent that you can, if you can keep an open mind and an open dialogue going without judgment, and that's going to be hard to do, your kid's going to be more likely to talk to you about when things are not going well. So if your kid tells you about something that they saw on social media and your first instinct is to freak out and say no more social media for you, the chances that they're going to tell you something in the future are probably not great. But if they come to you, they tell you something they did, and you were able to kind of hold that in and talk to them about how it made them feel, or like what's should happen next, or what are they thinking about, you at least keep that dialogue going. And then as you can kind of make maybe a kind of a calm plan for like what the next step should be. So try to keep that line of dialogue open and try to reserve judgment as much as possible. Teens are doing the best that they can, and this is a complicated world.
Thank you, Michael. Kristelle?
Yes, so wonderful conversation, important conversations to have. I agree with, this is such a great panel kind of group to have and offer all of those different perspectives. I think my last closing thought is that the lab has a lot of wonderful free resources available. We're at digitalwellnesslab.org. I just want to make a quick plug for our Family Digital Wellness Guide, which has a lot of different icebreakers for some of these kind of more complicated topics, including things like pornography. And then access to our clinical website is on there as well. And just another plug for the ratings and reviews also on Common Sense Media. That's something that we at the lab refer to all the time. And I think it's just a really great, again, free resource for parents to have.
Thank you. Andrea, last thoughts?
Yeah, so my big approach as a mom of 5 and a better screen time is to take a relationship first approach. So that's the most important thing. Even if your kid is like the most screen obsessed zombie or they're just completely sucked into a device, if you can preserve and nurture the relationship with your child, that's the most important thing. And that's really where it starts. And Michael alluded to that as well. And we do that by spending one-on-one time with our kids, by making our family rituals screen-free. So our dinner time and bedtime and those times when with my older kids were never interrupted by devices and now they are, make those times screen-free. Put your device away. Use a charging station as a parent. Put your device away and listen. And I just can't recommend that enough, just because I felt that disruption in my parenting as technology has changed. And so put your device away, nurture that relationship. And I think especially have hope for this generation. Like, these kids are amazing. They're going to do awesome things. And we just as parents need to be equipped to help them and mentor them through this.
Thank you. And Caitlin, you have 1 minute.
Okay. I agree with what everyone has said. It's been a great panel. I think I just want to maybe say as a final word, parents, please don't be too hard on yourself. You don't need to be perfect. This is a really difficult context. We're coming out of the pandemic. Stress is, there's not enough childcare and child support. And so, just thinking holistically about your family and having healthy practices, the relationship central, and also give yourself a break.
Thank you. Thank you, our great panelists, and to our middle school and high school students. We do have one last video to share. Before we do that, please do not forget to complete the survey. The link is in the chat. And subscribe to our social media for events and up-to-date information and resources. Our panelists shared a lot of tools, information, resources. Don't worry about that. We've curated a list of those resources that will be available very soon. And we are just so happy to share this space with you and learning so much about social media, the harms, the benefits, and everything in between. So we'll close out our program with the last video of tips from our students. Thank you.
I think my phone, I've learned to put it in another room just because it distracts me, even if I don't have the disturb, because sometimes I have the urge to kind of grab it.
Like when your parents set up a time, let's say 30 minutes, I guess it helps.
I've gotten into the habit to turn off my phone about 45 minutes or an hour before I go to bed, or else if I keep checking it up until I go to bed, I'm just gonna get distracted on something else and then just keep going. And then I won't go to bed and I need my sleep to function.
For me, if I feel like the do not disturb or the focus feature isn't really working, sometimes I'll just let my phone die and I just won't charge it so I can just stay off of it for a while. And on my laptop, since I do use my laptop for other things outside of school, I won't open the windows that have my personal Gmail accounts on it. So that helps me stay focused on my schoolwork.
My parents, they would give me a 5-minute warning or something, or a 10-minute warning till I have to get off. So then I can finish up my game and then not start a new one.